Minister, firstly, could I thank Government for following through on the proposition to build a second cath lab at University Hospital Waterford, which passed in recent days, and I addressed it with the Taoiseach yesterday, and I'm looking forward to engaging with you over coming months to ensure we get the recruitment of staff and get that lab operational as soon as it is commissioned. Just in terms of the vaccine rollout, which I suppose is the most topical issue at the moment, Minister, and you have mentioned Israel, and I think we could look at Denmark and Estonia for looking at what best in class has done at the moment with respect to vaccine rollout. And a key component of that has been the support of ICT systems that those countries have in place. Now, I don't think anybody would argue that we are very deficient in this country at the moment in terms of integrated health ICT systems. This came up when you and I were on COVID committee in terms of test, trace and isolate. And we saw that once we got over maybe 1,000 cases a day, we just didn't have the ICT backup. And I'm wondering, what is your department doing to address this at the moment? I know there's been significant monies expended under private contracts, but can you give us any update on where this is going? Also, you're probably aware that a lot of GP systems are not actually integrated with the HSE dashboards. And again, this is going to cause problems as numbers ramp up in terms of vaccination. Also, vaccination numbers, I think the number that was said recently was 8,500, and maybe there's more now at this stage who are registered. But I'm just wondering, in terms of those, how many hours dedicated time are some of those people going to be able to give? And also, other deputies have highlighted here this morning some of the interviewing requirements, which are frankly laughable. But beyond that, we've public dentists that haven't worked in the system for almost a year. Are they on the list? Retired GPs should be mandatory just to allow them on. I can't understand why they have to be interviewed. And pharmacists, again, if you'd mentioned, but we need to get those into the vaccination centres if we're going to be rolling out 1 million vaccinations a month. And then in respect to the vaccine portal, Minister, I think deputies have highlighted issues with that this morning, but one of the issues I understand is that we have about 20% more PPS numbers in the country than we have per population, and surely this allows the opportunity there for fraudulent applications to the portal. Maybe you'd like to comment on that. Beyond that, I think the responsibility for vaccination is huge, Minister, and you have a very, very wide portfolio within the Department of Health, too wide, I think, possibly for any one minister. And I wonder, would you or government have looked at maybe considering appointing a single minister to oversee the vaccination process, like Minister Feehan, to allow you, Minister, to look at the other significant issues we have in the country, not least the burgeoning waiting lists and the access to services, which are huge in the moment, and basically COVID has overtaken everything, but there are significant hardships for patient cohorts in the country. Beyond that, Minister, I spoke to you before about industry engagement with the likes of NIAC and NEFIT. And as you know, I brought antigen testing to NEFIT last May, I think it was, the technology and a company who could do that. And here we are nearly a year later, and we're still talking about just about starting to roll it out. And if you look at what other countries have done, again, best in class, they're way ahead on this issue. So I would ask you maybe to have a look at that again. And also, in terms of antigen testing, vitamin D has been spoken about. It has been used throughout the world and has recommended, yet we have made no attempt whatsoever to see about giving vitamin D as a prophylactic to help COVID. And beyond that, in terms of antigen, Minister, I've written about to the Construction Industry Federation about trying to use antigen testing, which they say they have used to open the construction sectors. Can we not now implement this for construction, for schools and for tourism hospitality? I'd ask you, Minister, what we are learning based on COVID-19, and more importantly, how are we defending against COVID-20? It can only be a matter of time before we have another repeat of this. That's the view of the WHO, or we get a significant variant into this country which erodes our vaccine trials. So I would ask you again, Minister, what are we learning? What are we putting in place? What is government going to do? Are we going to put health surveillance on a firmer footing in this country? I applaud what government has done around mandatory quarantine. I have been asking for that for some time, albeit it's problematic. But you might just address what's the government plans in terms of new variants as we go forward, even as we get the vaccine process out. And just lastly, Minister, could I say, I think communications are key. and that is coming up time and time again. I think government can keep the public on side as we roll it out, but the roadmap needs to be clearly highlighted, Minister, communicated, and updates, weekly updates properly provided and on all aspects of the vaccine rollout protocol will help immeasurably.
Thank you, Deputy Minister.
Thank you, Deputy, for your questions and for your comments. And can I share your enthusiasm and happiness that we have had such progress on the second cath lab. I know Minister Butler has worked very hard on it, and I want to recognise your own efforts as well. You and I spoke in the previous Dáil when you and I met with the local cardiologists. It has been a core focus. It is in the programme for government, and I think it's very, very welcome, most importantly for the people of Waterford, for all the reasons that we have discussed before. In terms of the IT systems, it is absolutely clear that we need a comprehensive system for dealing with issues like this. The teams are using various different systems. They have linked them together as well as you can with such systems, but really what is required, and in fact I met analysts and IT experts just yesterday to talk about putting a proposal together for a new system. Probably not something that will be used for our current response, but we need to make sure that we have something solid in place for the future. So progress will be made on that. With regard to rapid testing, just very quickly, you'll be aware that I appointed an expert group to look at this issue, and I'll be launching the report later on today, and it'll come as no surprise to you that the report is supportive of more widespread rapid testing, as indeed am I, and we're putting those plans together now. Thank you.